Welcome to Learn at Work, a webinar series presented by Work, a journal of prevention, assessment, and rehabilitation, published by iOS Press in the Netherlands. I'm Karen Jacobs, the founding editor of Work, and I'll be the moderator today. So I'm going to turn this over to Andy, who is in Hong Kong, and he is going to give you some background about himself and talk about his very interesting study and paper, which we published in Work. So Andy, I'm turning it over to you.
Hello everyone. I would like, first of all, to thank Karen for giving me the opportunity to share my study in this very special platform. Please let me start by saying just a few words about myself. I'm Andy Zhang from Hong Kong Polytechnic University in Hong Kong. I'm an OT by training, but I also have professional training in occupational safety and health. My research interest is centered on work disability prevention and management for injured workers, occupational drivers, and cancer survivors. And my research agenda is organized around three core questions. The first is, what are the human factors resulting in work injury? Second, what are the risk factors in delayed return to work? And the third is how different return to work interventions, including both rehabilitative and administrative strategy, can promote timely and safe return to work. The study I'm going to present today actually is a concerted effort with a group of researchers who are interested in return to work of cancer survivors, which include Dr. Liu Xuxian and Wen Fengji. They are from Rehabilitation Medicine Center of West China Hospital of Sichuan University, and Wen Qikong from Tongji Hospital, Tongji Medical College, Huzhou University of Science and Technology, and Wan Qin from Shanghai Sunshine Rehabilitation Center, and last from Fan Dailing and Chen Yu. They are from the Southwest Hospital of Chongqing. In this webinar, I would like to report our study titled Work Productivity Loss in Breast Cancer Survivors and its effect on quality of life. I will begin by telling you the background of our study and end with take-home message. With the advancements of medical examination and treatment, cancer patients or cancer survivors are growing in number. Cancer is now considered as a major type of non-communicable chronic disease. However, given that long-term survival rates are high and that the age of diagnosis is well within the workforce age range, return to work is an important process for many cancer survivors. However, there are many factors affecting return to work and work performance of cancer survivors. In mainland China, less than 20% of breast cancer survivors could return to work, and they tend to return to work on average 21st month after diagnosis. It is well understood that some cancer survivors may be left with functional limitation after cancer treatment, and these functional limitations may arise shortly after cancer treatment, but others may last for years and have potential long-term or late effects arising from months or years after treatment have been completed. And they will definitely reduce the work ability and work productivity of cancer survivors, which in turn will affect their return to work or work sustainability. And on the other hand, cancer survivors may experience different forms of psychological distress, such as anxiety, depression, and uncertainty about the future, particularly as a result of their fear of recurrence, causing them to have a symptom burden, which in turn affects their work ability and their motivation to return to work. Age and gender can be barriers to return to work of cancer survivors. As expected, the older the cancer survivors is, the lower the chance of return to work. However, studies have also shown that there is a gender difference in return to work of cancer survivors. Namely, the women are more likely not to return to work. It's interesting. And the female cancer patients are more likely to quit their job during the year they were diagnosed with cancer compared with female cancer patients. And they are less likely to return to work than their male counterparts, okay, as they are, as maybe the female cancer survivors or female cancer patients, they may not the only source of the incomes in their household. So, but work actually has an effect on the quality of life and psychosocial well-being of breast cancer survivors. Continuing to work after being diagnosed with breast cancer has been shown to be beneficial to all domains of health-related quality of life, such as physical well-being, social well-being, and functional well-being. In addition, women who continue to work throughout the treatment had lower levels of psychological distress, higher level of physical functioning, and higher quality of life than women who never return to work or return to work post-treatment or stop working after or during treatment. Unfortunately, some employer may have a view that the employees with cancer tend to be less work productive following diagnosis and treatment. And it explains why some employers are so negative about returning or about retaining certain cancer survivors who really desire to return to work. Presenteeism is a term describing an individual being at their workplace but not fully engaged with their work because of health issues. And on-the-job productivity loss and at work productivity loss are synonyms of presenteeism. It is still not known very well whether work productivity loss due to presenteeism affects the quality of life of breast cancer survivors. Therefore, our study aims at investigating the effects of work productivity on the quality of life of breast cancer survivors. There were three objectives to achieve this study aim. First, we want to compare work productivity loss, quality of life, and other qualitative and psychological measurements between the breast cancer survivors and lung cancer comparison group. Second, we want to explore the association between work productivity and quality of life. And lastly, we want to see whether work productivity loss can predict quality of life of breast cancer survivors. This study, we use a cross-sectional design and conducted in Sichuan province. And Sichuan province is a landlocked province in southwest China. The inclusion criteria for the breast cancer groups were female. They were all aged between 18 and to 65 years old. They all diagnosed with breast cancer from stage 1 to 3. They had completed primary treatment of breast cancer at least 24 months prior to the assessment part of the study. They were occupationally active. That means they work on a full-time, that means at least 40 hours per week, or part-time, less than 40 hours per week, basic at the time of the assessment. And they are all able to read and understand simple questions. And for the comparison group, that means the lung cancer comparison group participants have we have not received any diagnosis of cancer before. And we also have an exclusion criteria in our study. The criteria will if any participant have any history of being diagnosed with dementia, brain injury, epilepsy, substance-related disorder, and other disease that affects their ability to answer the questions, they will be excluded. As well as, of course, if they cannot give us verbal voluntary consent, they were also excluded from our study. And we have developed a questionnaire in this study, which consists of 3 parts. Part 1 are questions related regarding demographics, including information on age, marital status, whether or not they had children, and educational level. But for the breast cancer group, they also answer medical related questions, including states of tumor, treatment received, like surgery, radiation, and chemotherapy, so on and so forth, and the date of the completion of their primary treatment. Part 2 of our questionnaires are work-related questions, including type of occupation, occupational status, and the length of the time in current job. Moreover, participants were also asked to rate their perceived job stress at their present job on a 4-point Likert scale, from level to very often. And the last part of our questionnaire are questions from 4 standardized measures to assess psychological distress, cognitive functioning, work limitation, and productivity loss, as well as quality of life. The standardized measures to assess psychological distress in our studies was hospital anxiety and depression scale. It is a self-assessment scale for measuring depression and anxiety in general population, and it consists of 14 items and to form 2 subscales, one measuring anxiety and one measuring depression, and all questions are scored separately. And for the cognitive functioning, we used cognitive symptom checklist to assess a patient reported challenge at work involving specific cognitive function. It consists of 21 specific work tasks that can present cognitive challenges in the work environment. And studies showed, the factor analysis show these 21 specific work tasks are related to working memory, executive functions, and task completion. For the work limitation and productivity loss, we use a work limitation questionnaire. It consists of 25 items to measure impact of health problems and treatments on job performance and the effect of work limitation on productivity. This questionnaire was designed to be applicable to a wide range of health conditions, including breast cancer, in different occupational settings. And work limitation questionnaire measure impairment on 4 job task scales, including first, time management. And time management assess difficulties handling a job time and scheduling demand. Physical demands examines difficulties performing job tasks involving bodily strength, movement, endurance, coordination, and flexibility. Mental interpersonal demands examines difficulties which with collectively demanding tasks and on-the-job social interaction, and all output demands assess the impact on productivity at work. And the scores of all these 4 scales are weighted to form a productivity loss, which is an estimate of the percentage of the productivity loss at work. And for the quality of life, we use the European Organization for Research and Treatment Quality of Life Questionnaire C30 version 3. And it consists of 30 questions, 30 questions to measure various aspects of quality of life, and it covers 15 domains, including global health status, physical functioning, road functioning, emotional functioning, cognitive functioning, social functioning, fatigue, vomiting, pain, dyspnea, sleep disturbance, appetite, nausea, constipation, diarrhea, and financial difficulties. And in this study, we will calculate a summary score to rate the global quality of life of the participant. At the end, we have recruited 150 participants and 75 participants with a diagnosis of breast cancer in the breast cancer group, and another equal number of 75 participants in the lung cancer control group, and they all successfully complete the survey, and all participants were Chinese women. And you can see in this slide, most of the participants in the breast cancer group were 40 years old, and they were married and has children and had attained high school or lower educational qualification. And a high level of work stress was reported by 60% of the participants in the breast cancer group. Okay, we have 45 participants reported they have work stress, and the mean time starting current job was 7.6 years. Okay, for the breast cancer group. For the breast cancer group, if you can see from the right side of this slide, most of the participants were diagnosed of stage one of breast cancer, and the mean year since the primary treatment was 4 years. And the results of the independent, in this slide you see the results of the independent t-test. It showed that the breast cancer group had greater psychological distress than the lung cancer comparison group, as indicated in this slide. Particularly, you can see the anxiety and depression score. And the breast cancer survivors group also had greater cognitive limitation than the comparison group, indicated by the cognitive symptoms checklist total score. But this difference was not statistically significant. But for the work limitation and productivity loss as measured by the work limitation questionnaire, the breast cancer group had greater limitation than lung cancer group in all 4 domains. As you can see, all 4 domains, from the time management to the output demand. And if we by multiplying the productivity loss score by 100, the percentage of the productivity loss due to the presenteeism of the breast cancer group was 8%, while the percentage of productivity loss due to the presenteeism of the lung cancer group was just only 2%. For the quality of life as measured by the European Organization for Research and Treatment Quality of Life questionnaire, as you can see from this slide, there's a significant, some of the domains are quite significant there's some significant difference between the two groups, and the breast cancer group have a lower quality of life in these different domains. But if we focus on the summary score, and you can see breast cancer group had a lower summary score than the lung cancer comparison group, which means the global health quality of life of the breast cancer group actually was lower than the lung cancer comparison group, and it attained a statistical significant difference. And this slide shows you the multiple linear regression analysis. We used a forward stepwise method, and the results indicate that only level of work stress and work limitation questionnaire productivity loss score were statistically significant predictors of quality of life of our participant. And the total variance explained by these final models was of 42%. Okay, so our study actually have shown that the breast cancer survivors group has statistically significant lower quality of life and greater work limitation than the lung cancer comparison group. And this result actually is consistent with the findings of previous study. And breast cancer survivors in our study had significantly greater productivity loss at work when compared with the lung cancer group. And the productivity loss due to presenteeism of the breast cancer group and the lung cancer comparison group was 8% and 2% respectively. So if we calculate the mean difference between these two groups, you can find the difference between breast cancer group and the lung cancer comparison group was 8%, was 6%, which is very high, which is quite high if we compare with previous studies. And in addition, we also find the psychological distress such as anxiety, depression, and cognitive limitation at work in our studies were not associated with the productivity loss at work, and these findings actually is different from the previous finding. Okay, and previous studies also shown that employment status that is being employed was the significant predictors of quality of life of breast cancer survivors, and that continuing work during and after the diagnosis could help breast cancer survivors maintain better psychosocial well-being. This is what we can also obtain in our studies, but our findings also suggest that work productivity loss was one of the other significant predictors of quality of life in the breast cancer group. And these findings, in our opinion, which has not been investigated before. But unfortunately, in our study, we did not examine work-related factors like type of job, job demands, level of peer support, workplace policies, procedures, culture, and resources in details, because these work-related factors can also affect work productivity. But unfortunately, in our study, we did not examine these factors in detail. So you can say this is one of our major limitation in our study. So to prevent work productivity loss of cancer survivors, in our opinion, we suggest 3 ways. First, to enhance self-efficacy, to do more physical exercise, and implement flexible workplace practice. Self-efficacy is a cognitive mechanism based on expectations or belief about one's ability to perform actions necessary to achieve specific goals. And it affects individuals' decision-making process and subsequent actions, such as engaging in physical activities, training eating habits, managing cancer, or return to work. Okay, so interventions to enhance self-efficacy, especially the self-efficacy specific to return to work, are promising in terms of helping cancer patients remain in their job. Study also already prove that a low level of self-efficacy effect not only the actual impaired working capability in cancer patients, but also their anxiety and fear about various stresses in the workplace. For the physical exercise, studies have already shown that it can help cancer patients to be physically and psychologically prepared for work, which in turn can contribute to a successful return to work and prevent work productivity loss. Other than physical limitations, individuals diagnosed with cancer, including brain tumor or lung central nervous system cancer, can develop cognitive limitations throughout the course of the disease. In recent decades, cancer-related cognitive impairment has frequently been reported in patients treated for lung CNS, lung central nervous system cancer, particularly during and after chemotherapy. And the cancer-related cognitive impairments, in short, CRCI, often called chemo brain. It has been studied as a common side effect amongst adults with cancer, which can persist well after treatment completions. And the preclinical studies, that is like animal study, already indicate aerobic exercise improve cognitive functions, including decrease the systemic inflammations and oxidative stress, enhance plasticity of the brain, increase levels of brain-derived neurotrophic factors, and improve cerebral blood flow, and hemoglobin levels. So exercise can help to improve the cognitive functions of the people. And the recent studies conducted by Leeson and his colleague have already pointed out that a multidisciplinary intervention that include physical exercise and occupational counseling program can enhance return to work self-efficacy, work ability, and work sustainability. Last but not least, implementation of flexible workplace practice, such as adjustments of working hours and job responsibility, as well as gradations of job task difficulty, should be considered as an intervention to improve the work outcomes of breast cancer survivors. And employer is recommended to establish an inclusive workplace with policies about accommodation for employees with cancer, as well as a workplace culture that promotes supportive attitudes and action from the supervisors and co-workers of the cancer patient. And these are important elements to help the patients to return to work and to create a accommodating workplace. There are 4 different types of accommodations. First, can provide a graduate return to work plans and flexible work scheduling. Second, it can involve modifications of work duties and performance expectations. Third, it can involve provisions of retraining, we training and support at the workplace. And for the last type of accommodation can be provisions of modification of the physical work environment and provisions of adaptive aids or technologies. So these are all our recommendation. We can help the cancer survivors, particularly the breast cancer survivors in our studies, to return to work and to reduce their work productivity loss, to help them to secure in their employment. I will end my sharing with the following take-home messages. Work actually is an important component of full recovery, and work contributes to greater well-being and enhance one's sense of normalcy, control, identity, and meaning. And there are many factors affecting return to work and work productivity of cancer survivors. So we have to continue to iron out all these factors. Maybe we have to use multi-factorial models to understand the interplay of these factors, how they affect return to work and the work productivity of a patient with cancer. And the loss in work productivity can affect quality of life of cancer patients. So not only return to work, if they return to work, but they have a work productivity loss, and this can also affect the quality of life. So there's a need to explore the factors associated with the work productivity loss of cancer survivors, and to explore interventions to prevent this loss and to help the patients with cancers to have a better quality of life. So that's all for my sharing. Thank you so much for attention.
Thank you so much. This was so interesting. I love the picture of Hong Kong. Thank you for sharing that. I love,
Thank you.
Andy, your takeaway messages were so important for not just, people working with people with cancer, cancer survivors, but in general related to work. I can see so much of this being generalized to, maybe people who have been working from home because of COVID and now, are returning, to maybe their office or continuing to work from home. And maybe there was a loss in productivity too. So I think your results have a lot of meaning for cancer survivors and others. So thank you. So
Yeah, thank
Andy,
you.
thank you. What I'd like to ask as a question is what's next for you? Where do you think this, what would you like to do with more research in the future?
Oh, I think in Hong Kong, in Asia, we do not have very well developed or established care, or so we call survivor care plan for the cancer survivors. Okay, so I think there's a lots of rooms for us to investigate how to help the cancer survivors, okay, to reintegrate into the community, including into the workplace. I'm looking for any opportunity to work with researchers, with the people with common interests, okay, to develop any policy to help the cancer survivors, okay, to return to work and help them to sustain in the workplace. So it involves a lot of interventions, or even it involves some social policies making. So So you can say from a very microscopic level, I'm looking forward to develop any interventions or some protocol or treatment plans to help the patients with cancers to work. But at a more macro level, I plan to talk with the policies maker to see whether we can have some formal framework to help the cancer survivors to return to work. Of course, it involves a lot of discussions with the stakeholders, particularly the trade union, the employers, okay, because in Hong Kong or in some Asian country, the employer, not all, but some employer, they may have some negative views about the workability of the cancer survivors, and they tend not to hire them because of the cancer. Okay, so this is what I'm planning to do in coming few years.
That sounds so important. So it sounds like there are some real stigma.
Yes, yeah,
Mhm.
yeah, you can say, yeah, social stigma. Yes, we still have some social stigma in Hong Kong. I'm sorry to tell you that.
Yeah, so it sounds like it's something that needs to be addressed systemically.
Yeah,
Um,
yeah,
it's happening in the workplace and other places as
mm,
as
mm,
well.
yeah,
Um,
mm,
you know, I can see you leading the way
yeah,
uh, in
mm,
research, um,
yeah, mm,
being widely disseminated through, I hope, the press.
yeah,
I think
mm,
it's really important.
mm. Yeah. But for the stigma, I'm currently doing a study to investigate different domains of stigma of lung cancer survivors, and we have a preliminary results showing that stigma actually not only from the public, from outside, actually the cancer patient, the cancer themselves, they also have some kind of self stigma. Okay, they think that they are no good, they are incapable to work, and they may have some bad fortune, okay, bad luck. If they go back to work, they may cause the whole workplace to have bad luck. So it is we are still actually it's very interesting, or maybe it relate to the Chinese culture. But we do not have any final conclusions about this kind of self stigma, whether it is related to the belief or related to the culture, or actually related to the social results of the social stigma. Okay, so if I have time, I can share with you another paper, another manuscript in the future to work.
That's great. I'd love to see you submit it to the work journal.
Mm.
And I think so. So, Andy, you're thinking about, or you are already working with people with lung disease, lung cancer.
Mm.
What is that population?
Yes, yeah. Because lung cancer is also a very common cancer type in Hong Kong, in China. You know, I think half of the population, Chinese population, they smoke.
And you know, this is a population that I don't know how many occupational therapists are working with, perhaps outside of Hong Kong right now. And I think it's an important population for us to consider working with.
Yes.
So, Andy,
Mm?
any thoughts that you would like to share before we conclude this webinar? Is there anything that you'd also like to share with our listeners?
Oh, I think my last remark is I think cancer actually uh, is a very common problems nowadays, and we cannot exclude the possibility some one day we got cancer, but actually cancer is now is not is a terminal disease. With the advancements of the medical technology and early detection, cancer actually is now a chronic disease. And so the next step is how to help the patient with cancer to work as a normal people, how to help the cancer survivors to manage this chronic disease. I think is one of very important directions for all researchers in this field.
Excellent. Thank you so much. Andy, thank you. I know this is the wee hours for you, and I'm so grateful that you presented on your very important research, and I wish you the best. And I want to thank everyone for joining our Learn at Work webinar series. You can learn more about the journal on our website, workjournal.org. Thank you, everyone.